I'm going to demonstrate for you all how to do a proper and safe medication administration. So first, let's start by reviewing the MAR, otherwise called the Monthly Medication Administration Record. All throughout DRCC, these MARs look the same. We have our client's name, the program that they reside in, the pharmacy that we receive their medications from, the current month that we're documenting for, and these numbers along the very top, those are the coinciding days of that month. We have their primary physician's name as well. All medications that are ordered are listed along this column here. The times that those medications are due are in this next column here. And keep in mind that this time that medication is due, there is an hour before and an hour after window that medication can be given. So say a med is due at 6 a.m. You have from 5 a.m. to 7 a.m. to give that medication. If that medication is given outside of that parameters without approval from a nurse or a doctor, it is considered a medication error. So where we would document our initials, signifying that we gave a medication, is we follow along from that time all the way to the coinciding day of the month that we're working. And where those two intersect, that is where we would put our initials. On the back of a MAR, there's a little key that we can utilize in case our client is away from the facility during that med administration time. They refuse that medication, and also if there was an error in documentation, we can circle our initials and then document that error in our client's medical notes. This next section is for staff signatures. So be sure that you sign your full signature and your initials in the boxes. This is so it's easily recognizable who gave what med and what day. As the month goes on, these MARs can get pretty full and difficult to determine. So if we can find that box and recognize whose initials they are, it makes it way easier to get in touch with that person. On the very bottom, this is for med refills from the pharmacy. So if you get a delivery from the pharmacy, take those medications, find the correlating med sheet that medication is on, and fill it in using the prescription number, the date it was refilled, some information about the drug dosage, the quantity that you received, the expiration date, and then your signature saying that you were the person that took those meds and checked them in. We want to be sure that the meds we receive from the pharmacy are checked in and put away in the proper place. So, I'm going to demonstrate how to prepare Steve Wilson's 6 a.m. medications. And before I do any type of medication administration, I'm going to wash my hands, utilizing a hand sanitizer or washing for 20 seconds in the sink. So once your hands are clean, I can take a look at the MAR, and starting at the very top, when you're preparing a med pass, always start at the very beginning of the MAR and work your way down in order. We never want to prepare meds by jumping up and down and going all around because that's when meds can get missed. So starting at the very top, I see it's a 6 a.m. medication, and I'm going to be signing off for the 25th of the month. So I'm looking through, there's the 25th, and it looks like that medication was discontinued, and that's marked by an X and being highlighted through. So I don't need to prepare that medication. So I will go down to the next med. And this looks like it's a 6 a.m. medication. And it's loxapine, 25 milligrams, 2 capsules every morning for a 50 milligram total. So that will be the first medication that I'm looking for. I go into the med administration area and go into the client's designated med spot, and I locate that medication. There it is. This is where you perform your first comparison of the label to the MAR utilizing the 5 rights. So, it's the right medication, loxapine, yes. The right person, Steve Wilson. The right dosage, 25 milligrams, 2 capsules every morning for a dose of 50 milligrams. the right time, 6 a.m., and the right route. These are pills, so they're going to be taken in an oral form. So once I perform that first check, I can grab a med cup and I'll put the prescribed dosage in the lid if you're utilizing this type of pill bottle. The reason that we use the lid is because we don't want to ever touch oral pills with our hands. And also, if you make an error and they all come spilling out, we can pour them back and start over. If we pour the pills directly over a med cup, that increases the chance for spilling. So, I put the prescribed amount of capsules in the lid. There we go. So, once they're in the lid, this is where you'll do your second check of the label. So again, I'm checking for the right person, Steve Wilson, the right medication, loxapine, the right dose, 25 milligrams, 2 capsules every morning for a 50 milligram total. Correct. The right time, 6 a.m., and the right route. These are capsules, so they'll be taken by mouth. Once we've performed that second check, then we can transfer the pills from the lid into the med cup. Now, before we put the loxapine away, this is where you'll do your third and final check of the medication. So, we're going to look for the right person, Steve Wilson, the right medication, loxapine, yes, 25 milligrams for two capsules for a total of 50 milligrams. The right dose, yes. The right time, 6 a.m., and their pill form, so they'll be taken by mouth. And we can put that med away. Now, to signify that this med was checked and it was safely prepared and it's in the med cup ready to give our clients, we go to the MAR, find that medication, find the correlating day that we're working, that we're going to put our initials, and instead of our initials, we're going to put a dot. And that dot signifies that that medication is safe, it was checked, and it's prepared and ready to give. We would repeat that same process with every 6 a.m. med that you find going through the MAR. If your program utilizes these blister packs, it's the same concept. The label that we would compare to the MAR is right on top. And how blister packs work are they come in a card and they're numbered. And we always start with the arrow and the largest number. And we always work our way down. When it gets to this solid area here, sometimes it's blue, this just means that that medication is ready to be ordered. So be familiar with what your program's policies are regarding ordering medications. So, to pop a pill from a blister pack into the med cup, all you need to do is place the med cup directly underneath that bubble and push it through into the med cup. You will also date, time, and initial right above where you popped it from. And again, this is just for accountability of where that med went and who gave it. If a medication is a liquid, sometimes they're labeled as a suspension. And what that means is when it's sitting still, it'll separate. So we need to shake well. When we're preparing a liquid medication, again, the label that we'll do our 3 checks on is right here. And you'll compare it to the MAR just like a bubble pack or a regular pill bottle. When we're preparing, we'll unscrew the lid and we always want to set it down on the table upside down. We never want to face it this way because then we just contaminated the top of the lid. When we're pouring a liquid medication, you always have to have it on a flat surface, such as the table, and you're going to pour, looking at it from eye level. And the reason that we do this is to get an accurate read of the dose. All the milliliter measurements are listed on the side of the med cup. If we're looking at it from above, we won't get an accurate read. And if we're looking at it from too far down, we won't get an accurate read. And also, we can't hold it with our hands when we're pouring because you can see right here that the unlevel of the liquid makes it so we can't get a proper dose read as well. And also, if you put too much liquid in the med cup, it's not considered contaminated if it's in the med cup. So you can pour it back and start over. Once all the medications are prepared and they are given, and our client took them with no issues at all, then we would go back to our MAR that have all the dots, and where the dots are, that's when we would put our initial. Be sure to only initial after a medication is given and there was no problems. And always, always initial after you've performed each med pass. Don't wait until the end of the day to document your initials on the med sheet, because ultimately something's going to happen and you will forget one day. And if a thing isn't signed off, it looks like it wasn't given, and that can cause a lot of errors. And your program director has every right to call you back in after you've left the facility to come back and have you sign it. So always just be sure to do proper documentation after each task was done.